Sexual Violence Justice Institute is pleased to bring you this presentation today. As you see from the slide, our work is to equip multidisciplinary teams and professionals with tools, concepts, training, and resources to create a victim-centered response to sexual violence within local communities. Welcome. I'm Sharon Haas with the Sexual Violence Justice Institute, and in my work with SVJI, I provide technical assistance to multidisciplinary teams, and in particular, my role focuses on helping teams to assess progress and the impact of your work together. And we're very pleased to have Professor Roberta Gibbons with us as well. Dr. Gibbons has extensive experience in evaluation, as well as working with sexual assault survivors through her work with the Aurora Center at the University of Minnesota. Roberta has a special talent for making a challenging topic, evaluation, accessible, and dare I say, fun.
Hi, Sharon. Thanks for the kind introduction, and thanks to all of the participants for their interest in this topic, or for doing a nice job of dialing in and feigning interest. The word evaluation can trigger some pretty strong responses. We hope that by the end of this webinar that it feels nice in Minnesota, warm and cozy for everyone, or at least worthwhile. Sharon and I really think that what you get from evaluation is worth the time that you put into it, and we're going to try pretty hard to convince you all of that over the next 45 minutes or so. One key point to remember is that evaluation is something that we all do pretty naturally in our everyday lives. When we go out to eat, we evaluate the restaurant, and based on that evaluation, for example, of the food, the ambiance, the service, and our overall experience, we decide if we will return. We evaluate movies and often share our evaluation of them with friends and family. And in both of these examples, we have some standards against which we are making our judgments. And the judgment of merit or worth of something is exactly what evaluation is all about. So it shouldn't be something that's completely foreign to folks, since it is something that we do every day, just not of the things we're working on.
Thanks, Roberta. For my part, I think it's safe to say that all of you who work with teams and multidisciplinary collaborations want to know what difference you're making with your system's response, and how and if it's leading to better outcomes for victims during the course of a sexual assault case. I think that's generally true for all of us. Think about the healthcare professionals, the law enforcement officers, prosecutors, advocates, and others with whom you work. Probably one thing that they share in common is that they want the work that they do to matter, that all of you want the work that you do to matter, to be beneficial, to make a difference in the lives of others. So that's what this presentation is about. It's about building into your work ways of checking out what difference you're making and seeing some results. We'll introduce you to the steps in an evaluative process that you can use with whatever questions your team has about progress and impact. And then we'll use some examples of ways for teams to answer specific questions. Some of the things we'll explore are teams' different stages of development and particular contexts, such as urban setting versus a rural location, and we'll point you to some tools and resources for doing this evaluative work. And finally, we'll give you an opportunity to ask questions about what we've shared. But before we get started, we want to encourage all of you who work with teams to consider the ways that you can get help and support for your evaluation work. This can be inviting someone from an area college or a university to participate on the team, or there might be a member of your team who has evaluation interest or experience. So do consider the evaluation talent that might be around you and make use of it. We're going to provide you with a framework for how to think about evaluation, but you'll want some help and some support from evaluation champions for some of the parts of this process, such as survey design, for example. So before we get started here, let's take a moment to find out by a show of hands up in the left corner there, how many of you are currently involved in some kind of evaluative process with your team or with your collaboration, including case consultation, needs assessment, monitoring your progress in some way? Okay, we've got some hands there. What kinds of things are you trying to assess or learn? You can send your responses in the chat bar. All right, it looks like lots of hands in terms of community needs. System consultation. What types of continuing education is needed? Looking at SANE response, the SANE process, victim satisfaction, impact of work on the actual client, sexual assault response efficiency. All right. So quite a bit of evaluation, implementation of the SARTs, a number of evaluative processes going on out there. All right, thanks very much.
So we're gonna start here by thinking about how we assess team progress and impact. And I can tell from the information coming across chat that a lot of you out there are actually doing some of this work already, so we'll look forward to any input that you might have for your colleagues. First, I want to talk about the title of this slide. It says Assessing Team Progress and Impact. And as I talk about it, I want you to think about progress is sort of being process. So they're not perfectly synonymous, but really when we're talking about team progress, we're talking about improving the process of what we're doing. And when we talk about impact, we're really talking about results. So what are our outcomes? How do things look different because of the work that we're doing? And so this sort of cycle of evaluative thinking is one way to think about how we can assess, make sense of, and improve both the progress or the process and the impact or the results. So let's start at the top. The first question we want to ask ourselves really is, what does success look like? And it's a question that seems simple at first, but it's a question that can have a lot of sort of complex and overlapping answers. So for any evaluation object, and by evaluation object, that's kind of evaluation nerd talk for the thing that we want to evaluate or assess. So I mean a thing, a person, a process, an organization, anything that you're evaluating is sort of considered your object. So for any of these objects, you can ask, what does it look like? And what might it look like? What might this person or organization or process look like if I'm successful at reaching my goals and completing my tasks? So there's sort of a before and an after picture. Before would be what it looks like now, and after would be what do I think it's going to look like if I'm successful? And that's how we can start really thinking about how we're going to define success. Next, we think about information sources. Who or what is going to inform us about whether or not we're reaching our goals? Okay, so what can provide us with information or data that applies to our evaluation object or the thing we're evaluating? Who are the reliable sources of information? Are there people who know about this evaluation object? Do the opinions of a group of people matter here? Or are there written records someplace that I can have access to? Ideally, we'd really like to have information sources that we can rely on year after year so that we can gauge change if it is indeed happening. And I know that's why we're all doing this work, is because we want to see change. Third, the third bubble down talks about or asks us to think about ways to find out about our evaluation object. How can we best get the information that we need from the identified sources? So do we review written documents? Do we conduct interviews? Can we collect data through a survey? So this is really a question about the methods that we're using. Is there a situation or an interaction that we can observe? So definitely we can use interviews, we can use surveys, maybe observations, etc. And we want these different ways of finding out are available regardless of what our evaluation object is. Next, we're thinking about organizing responses or input. And by that, I simply mean that we're trying to make sense of the data or information that we've collected. What's it saying about our process? Really, what picture does it paint? What does it tell us about the extent to which we are successful? And by the way, that language, that's really sort of my favorite evaluation language. We don't want to ask a question, are we successful? But we want to ask, to what extent are we successful? Because we don't want a yes or no answer. We want to allow for a more comprehensive and nuanced answer and assessment of what is going on. So if we ask to what degree are we successful, it really allows for degrees of success to be measured. A lot of the time, the answer to are we successful is sort of. Yeah, sort of. We sort of are. And we want room for that. We just want to be a little more detailed and systematic about what that sort of means. And then after we organize our data or information, the next step is really to take the information back to the team and to ask yourself, how can I best share these results? Am I going to be sharing raw data with the team? For example, if I do a survey, am I going to give my team all the surveys? Or am I going to prepare a report, some sort of summary data, which is usually the best way to do it? We want to know what will most benefit the team and really what is their time for. And next, we want our team to help us determine what is learned so that we can best use what we learned to improve what we're doing. And you know, if we skip this step, and believe me, after going through an evaluation process, sometimes teams are tempted, okay, we did it, we collected all the data. We did it, that's great. And that is great, but you're halfway there after you collect your data. Sometimes there's sort of a lull in the energy then, but really if you miss the next step, the step about determining what you learned, then really you may as well have not done the evaluation work to begin with. Because when we take the time to figure out to what extent we're successful, we also need to take the time to think about how we use that information to improve our success the next time around. What changes can we make now based on what we learned? And what's working well? What do we want to keep? You know, what are our aces in the hole there? Finally, it's really most helpful if you do it again. And we don't say that to exhaust you, okay? We're really saying that if we build evaluation in as a part of our work, something that we do every year, something that our team and our community that's working with us expects, then we're building capacity for evaluation, we're building an expectation for it, and we can continue to assess the trajectory of our success year after year. Okay, so let's just think of a quick example here. I talked earlier a couple slides ago about how we naturally do evaluation. Every day of our lives we're evaluating things. So let's think about the restaurant example. Okay, so what does success look like? What does a successful restaurant look like? If I'm going to assess a restaurant, I might have some standards or some ideas about what I think makes a good restaurant. And I'm going to give you just a second to think about what you would look for. And when you go to a restaurant, you determine it's good. What makes it good? Okay? And for me, I might say, well, am I greeted warmly? That might be one question. You know, to what extent is the greeting a warm greeting? To what extent is the restaurant clean? Okay? I might judge it. I want to know, is there something for everybody? Okay? Maybe I have people in my family who like different things, and I want a restaurant with a big menu. And then I want the service to be fast and pleasant. I don't want to go to a place with, you know, stuffy waiters who condescend to me because I chose the wrong wine, okay? I want the food to be good, and I want reasonable prices. So those might be my standards, and I see that a couple people have written in about what they might look for as well. So certainly I can learn those things. Those are my questions. So for my sources of information, or information sources, definitely going to the restaurant would be a place, and using myself as a source is really good, but there are other places too I can get information. Maybe my friends have been to that restaurant, maybe my family members, maybe my work colleagues. Maybe I'll look at restaurant reviews to help me determine. So there are people and there are written documents that can be sources of information for me. And then I might think about methods or ways to find out. So I can interview family members or colleagues, right? Or I can give them a questionnaire about the restaurant. I can do document review, which simply might mean reading reviews or studying menus. Certainly observation. I can go to the restaurant and see how others are treated. And probably the best way in this example is to do some sort of self-observation, to go to the restaurant and experience it myself. If I'm going to organize responses, I would want to put all that information together. So I'd want to look at what different people said, what restaurant reviews said, what my own experience was, and put things together. And then put everything in summary form, organizing it, and then depending on who my team is, it might just be me, it might be my family, maybe I'm doing this work for an organization or a book club I belong to, and I would want to present to them the information that I have. Finally, I want to ask, what did I learn and how will I use it? And maybe I will learn that, that the restaurant meets some of my standards. It's kid-friendly, it has good service, the prices are reasonable, but the menu's limited and the food's good but not great. And so the next time I go, I'll be sure to know that that's what I can expect and that it's a good place to take my kids and that sort of thing. But if I want a really nice meal out with a friend, that it's probably not the place that I'm going to go. And if I do it again, I go back to the restaurant. Maybe if the food declines or the service isn't as good, maybe I'll decide never to go again. So my judgment might change based on my next evaluation. So that's just a real simple idea about what in everyday life evaluation might look like. But let's come back to the work that you guys are doing every day. What does success look like for you? I want you to think about the questions that you see on the screen. What did you want to happen? What change are you hoping will occur? And thinking about the before and after. What did the situation look like before you started? Okay? And what are the things that would tell you that you're achieving your goals? We talk about considering what it looked like before you started, and by that we really mean if the steps you've put in place are designed, for example, to make victims feel more inclined to report, how will you know if reports are increasing? What did it look like when you started? Is there something that you can measure? Are there some numbers here? And so what follows is an example thinking about what success can look like. Okay? So for many of our teams, we might answer this question that success will look like this if the things we put in place are achieved and we reach our intended outcome. So here are some examples. What you see here are goals, okay? Some of these are shorter-term goals, some are more medium range, and some are longer-term goals. And, I think it's really important to have goals at various terms or goals that we might accomplish more quickly and goals that are more extended. Because sometimes we just think more about the long-term goal. We want prosecution rates to increase, or we want the rates of sexual violence to decrease. And those, of course, are really, really important long-term goals. But in order to reach those goals, we really have to reach a number of shorter-term or more medium-term goals ahead of time. And we can get the best information if we're able to have goals in place or ideas about goals that we might achieve at different times, because usually the longer-term goals are dependent on the shorter-term goals. So let's look at this first goal, for example, that advocates will consistently be contacted when a victim is present at the hospital. Maybe for short, this in itself is a goal, but it can be broken up into different shorter and long-term goals. So for this one, you definitely want to make sure short-term that you're informing all parts of the system of the value and purpose of advocacy. And then for a more medium-term goal, we might write this into the protocols and expectations of how and when an advocate will be contacted. Now we want to know a little bit more long-term. We want to know if this new approach is happening consistently. So again, before we know whether advocates will be consistently contacted, there are a few things we need to do ahead of that goal in order to make sure that that goal happens. The next goal asks, will law enforcement use a different approach to report writing? Or rather, the goal would be that law enforcement is using a different approach, one perhaps that's more victim-centered. Again, for this we can have a short-term goal, one, that we develop a protocol. We can have a medium-term goal. It might be that everyone knows and has received some training on this new approach. And then this goal that you see in front of you is the longer-term goal, that law enforcement is using the new approach. So you can kind of see how, again, each one of these goals here can be broken up into different steps. The third signal of team success on this slide, that victims are listened to and respected throughout the process, can also have short-term and short, medium, and long-term goals related to protocol development for short-term, for training, that being the medium term, and then impact. In other words, you've gone through a series of training with the different disciplines about things to consider and supportive and compassionate ways to communicate with victims, and you've done the training, and now you want to know if there are signs that victims feel listened to and respected. The next goal that a number of victims are reporting is definitely a much more longer range goal. It's straightforward, but really it's somewhat dependent on all of the previous goals listed in front of it on this slide. Finally, the last goal is longer term as well. If our system gets stronger and in its response to sexual assault, then more offenders will be held accountable for their actions. All right. Let's look at each one of these goals in a little bit more detail. In our first example, we're defining success as victims are listened to and respected throughout the process of a sexual assault case. Now, we know this is true if victims say that they feel listened to and respected. That's certainly a primary way that we're going to determine whether or not we've reached these goals. We also want to look at ways that victims are listened to and respected, how we document them in law enforcement and prosecution records. Responders might share information about their approaches and results that indicate that this is happening, that victims are being listened to and respected. And finally, we believe sort of the next step that if there is this respect and this support, that victims and survivors will be more likely to actively participate in prosecution. So again, you can see how one goal really builds on the next. So in terms of sources of information, we could certainly look at victim survivors. We might do that. We can also look at law enforcement officers. Certainly, again, we want to know what survivors think, but law enforcement officers, prosecutors, advocates, nurses, etc., all of these people who are part of our system might have information about whether or not we are reaching this goal of victims feeling listened to and respected. Case documentation is another place that we can go to and do some sort of document review, because this written source can be a valuable piece of information as well. Next, let's look at ways to find out. And just in case those of you listening aren't aware or forgot, at the beginning of the presentation, we looked at sort of the cycle of the evaluative process, and those were each in bubbles. And what we're doing now is walking through in more detail how each one of those bubbles plays out with the goal of victims being listened to and respected. So once we identify our sources of information from the previous slide, we need to decide how to get information from our sources. So certainly we might use a checklist with responders that each responder can use to indicate whether or not they fulfilled a certain part of the protocol. We could conduct interviews with victims either individually or in groups, or ask them to fill out a survey. We might conduct document review of case files to see what we can learn. And perhaps we would interview responders, members of the team, members who are part of different systems. We might have an opportunity to observe the interaction of survivors with various system responders. And we can also have discussions among system responders to reflect on specific cases or issues. Finally, on a much more broad scale, we can look at institutional analysis. And institutional analysis uses a variety of methods to complete sort of a safety and accountability audit. This more advanced practice is happening in some parts of the country, but it's certainly not a place to begin. It's sort of one of those goals that we would look at once we have some other places, things in place. Now let's think about organizing the information that we collected or the data that we collected. You can see on your slide that there are a number of ways to do this. I think that this organization of information is the most fun part of this whole process because this is really where answers and insights begin to emerge. You can combine your checklists or survey responses by hand if you only have a few, or with the aid of a computer program, something like Excel or Access. Perhaps some of you have other software that you're currently using, and you could share information about that. If you are using software that you like, please give us a chat so that others can learn from your experience. If you use an online checklist or survey program such as SurveyMonkey or others like it, these programs will do the compilation for you, and this really saves a big time-consuming step of data entry. There are definitely tools for combining qualitative results, and when I say qualitative, I mean information we gather that is not numbers. So information from police reports or case consultations, case review. There are computer programs that help analyze that. A popular one is called NVivo, but you really don't need a computer program unless you have a whole lot of data. Often what we need is just a couple of people who can read through the data, and again, here I mean anything written, such as write-in answers on a survey or written narrative in a police report or in case files. And so if we have a couple of people who can serve as sort of the qualitative analysis team, their job would be to just read through that information or data that's been collected and to identify emerging themes or patterns. What are they seeing in that data? And if they do this separately and then come together and talk about what they've seen, then you have two different sets of eyes or three different sets of eyes to begin sort of an investigative process and a conversation about what we're seeing and what we're reading. One really important point to remember is to give proper weight to the data. So if you end up doing a survey and 3 survivors fill out that survey in 1 year, you certainly don't want to be making any big changes based on the results because that's a very small sample size. So if you have only 3 survivors, for example, that come forward at all, probably a better approach would be to do more in-depth interviews with those survivors if they so agreed. And again, finally, it's probably most useful for team members if your evaluation subgroup prepares a summary report of findings rather than presenting the team with raw data. Let's continue talking about bringing this information to the team. In your slide, you can see that we recommend to share information ahead of a meeting. So if you prepare a report, so you collect some data, you look at the numbers, You might put the numbers together, you look at some of the qualitative data, and you have some emerging themes or ideas about what's going on. We definitely want to share that information with our team. And because making changes based on what the information tells us is the primary purpose of evaluation to begin with, we want to give our team members some time to spend with the results before we ask them to give us input on what they think the results mean for future practice. I usually recommend giving people or team members about 2 weeks with the report and then holding a meeting where you can present report highlights and have ample time for discussion. Most organizations really sort of find that scheduling data collection and review right into their annual calendars works best. If data are reviewed at about the same time every year, team members can expect and even look forward to it. It really is a good feeling to be a part of a team where we are getting feedback about the work that we're doing. We're all out there, I know you guys are all out there doing this really hard work day in and day out, and to know whether or not you are making a difference can be really empowering and keep you moving forward in the work and keep your organization moving forward. So if data are reviewed about the same time every year, then there aren't any surprises. And no surprises is really great when it comes to evaluation. Of course, if you have any data from previous years, it makes sense to include it for comparison. And after a few years, you might even be able to see some trends. Are those reports going up? Is more prosecution taking place? And so are victims feeling more respected, et cetera? All of these things we can tell after we have a few years of evaluation data. Next, we're looking at what have we learned and how are we going to use these information. And, you know, I really discussed some of this on the previous slide, but it's definitely worth repeating that when it comes to evaluation, it's probably best to have some sort of evaluation subgroup or team who does sort of a lot of the heavy lifting. But then the smaller group can share the results with and ask for feedback from the larger team. I was always the evaluation sort of nerd, you know, the person who liked evaluation in the organizations that I worked for, and I continue to be in this role even as a professor. You might have a research or evaluation nerd on your team. You can ask them to raise their hand right now if you're all sitting around listening to this. Or you might have a local college with a student hoping for some meaningful research or evaluation work somewhere. So think about, in terms of how you'll use the information, think about who needs to know the information that you have. Certainly your team, yes, absolutely. But who are the other stakeholders? What's the best format to share the information? Is it a formal written report? Is it a summary brochure or a presentation? And finally, does it make most sense for you to share this information once a year, maybe twice a year, quarterly? Really thinking about who needs the information and when. And this slide is just a reminder. It says, do it again. It's really a reminder that evaluation is best done as a part of your work every year, and perhaps even every week. The process of evaluation can change from year to year. You might think of questions, new definitions of success, new sources of information. But what we're really looking at is how are we going to institutionalize the evaluation process? How are we going to make it so that we're doing this not just haphazardly or ad hoc? It's something that we're really having some sort of commitment to, that we're building capacity so that the work of improving the process and increasing our impact is work that is done every year. So we have a few more slides thinking about evaluation in a similar context. This one really sets up the idea that short-term goals are needed to build upon in order to reach long-term goals. It's really beneficial for you to lay out your team's goals as a progression, because when you're going to assess or evaluate what's working and what's not, it will give you an idea about where in the process things are going well, or maybe where things are breaking down. So if we look at the long-range impact here, saying that victims feel supported and they're able to assist in prosecution, before we can get to that, we need to know that advocates are consistently being called to the hospital. And before we can get to that, we need to know that all responders are familiar with advocacy and its importance. So again, we're really looking at building from one goal to the next. I've given you a lot of different examples about how you might collect data, what you might do, etc., but really you need to build a plan and choose methods that work for you and in your context. It's more important to get something established, even if it's simple and only gives you a little bit of information, than to maybe do something more complicated one year and then drop it the next. To build on something simple is really the goal here. Context is everything. What works for one team might not work for another, and your size and circumstances are definitely going to strongly influence your evaluation plan and your methods of collecting data. So for example, in a community of about 80,000 with many jurisdictions and multiple responder agencies, the evaluation plan will definitely look different than if it's in a smaller community. Okay, so in this case, we have a medium-sized community where protocols are well established and where there are about 30 sexual assaults reported to law enforcement each year. Okay? And so for this, we would build something different than if we're in a smaller community that only has 3 or 4 reports a year. So going back to our first community with the 80,000 and a well-established protocol, let's say that we want all victims who come to the area hospital or clinic to get a checklist survey, and imagine that the completion rate is very high. That would be a very, very high completion rate at 98%. We could all jump up and down and celebrate. And let's say about 40% of those people, survivors, indicate that they're prepared to be contacted in the future, and they give their contact info. Then that puts us in a situation of having information both from a checklist and possibly doing group or individual interviews. If we got interview data or data that was qualitative data written in on a survey, we could certainly code responses as well. So we can sort of imagine that for this type of case that there might be 3 meetings, a 3-person committee of your team, maybe working with a social science evaluator or a student from a local community college, to build a plan for assessing whether victims feel listened to and respected. And so they would follow the components that you see on your slide. And in talking to Sharon before this webinar, she was talking to me about how some teams are already experimenting with coding to help with identifying a case, like using the birthday, etc.
Or the day of the assault, a first initial.
Exactly.
Yeah.
Yeah. So to help keep track of response, so that reporting and non-reporting is known. And it also kind of makes sense in this type of situation if some people are working with advocates, survivors, and others are working with advocates and the police. You would then have really 2 very different sets of data. You'd have a set of data that shows you that these people are going to the police and making a police report. But the other group, we'll call them Group A and B, Group B is making police reports, but Group A is not. And looking at the data that we have about Group A, we might say, is there something going on with the types of cases, the types of offenders, the timing of the case, the type of police response, etc., that might make that group less likely to report. Okay, so we're reading chat right now. We will get to those in just a second. Thank you for the chat questions. So what might this look like in this community with well-established protocols and about 30 reports a year? There might be a group interview with victims. We would compile the information and certainly repeat that process. And I want you to think, if you do end up working with a social science evaluator, that person should really be considered a part of the SART team. He or she can work with the team committee through the course of the year and help with the evaluation plan and design, etc. So that kind of person could really help with group interviews and information compilation, etc.
All right, for our next example, we're going to talk about protocols. And one of the most common tasks of a team's work together is to develop new protocols for addressing sexual assault cases. And your protocols reflect the ways that your team wants each discipline to handle a sexual assault case, including key changes that your team is trying to institute. Once your team puts new protocols in place and introduces them to each participating agency, allows some time for them to be put in place and working, you'll want to evaluate whether or not each discipline or agency is using the new protocols. So to do this, one way is to find out if responders carry protocol books, or if they point to the protocols as what they use for a sexual assault case. Another approach is to prioritize or to pull out a key change in the protocols that you intended that the protocols result in, and take a look at whether or not that's happening. And so what follows is an example of that. For this example, success for the team means that law enforcement investigators are using the new report writing method that their team has written into the protocols. This new procedure was initiated and had active involvement from team law enforcement leadership and officers, and the department was introduced to this new method introduced to its officers and investigators by providing a training. And one example would be, some might be familiar with, using the Ending Violence Against Women online report writing training materials. And then the new procedures have been in place for about a year. So let's go back to that cycle of events, those circles that Roberta introduced us to. So starting out with what does success look like? What are the things that the new report writing procedure that the team wanted to change? So they're using this new procedure. Some of the parts of the procedure are about using language of non-consensual sex in police reports, capturing what victims are thinking and feeling in written reports, and effectively documenting things like fear or coercion. So where would you look to find out if these changes are happening? Some sources of the information. One of the things that's mentioned here is a review of police reports. Maybe some of your teams have participated or conducted some type of review of police reports. This is something that will depend on your team's relationship with law enforcement and with law enforcement leadership. If this new procedure is something that the leadership was interested in seeing implemented, it's possible that he or she or that leadership would welcome the team's offer to review the reports in a systematic way. That's a possibility. Other sources of information, useful information that you could look to would be officers or investigators who write the reports, as well as law enforcement leadership. Members of the team might be a useful information source about how the new procedure is being used, such as prosecutors who make use of the reports, or officers who hear feedback from colleagues or have input themselves. There may be some pertinent information that victim survivors could share as well. But a more likely source might be, in terms of the reports themselves, from responders. So what are the ways that your team might gather the information from the sources that we just talked about? There are a number of ways that you could get information that you're looking for from officers or from law enforcement leadership. You could use questionnaires, such as surveys. You could conduct interviews with a handful of pertinent responders involved. Observation is another way that you could gather some of this information by seeing what process is being used in report writing. Discussing specific issues that have come up around the way reports are written. Other considerations in terms of if you're thinking about designing surveys or conducting interviews, you might ask something such as, what changes have you noticed since the department instituted this new procedure? So a very brief set of questions that you could ask the pertinent responders. Writing surveys and interview questions is an acquired skill, as was mentioned earlier, so consider seeking assistance from one of the sources that was mentioned is area colleges or universities, and departments that would be related to this work, recruiting interns who have research, evaluation skills, or, as Roberta mentioned earlier, finding that evaluation geek on your team. There was a question that was asked earlier. There are going to be a few survey samples that we're going to include in a follow-up email, and we'll send those out to you. And also, if you're looking for specific survey samples, you can certainly contact us, and if we have a survey that matches your need, we're happy to share that. So organizing the information that you've gathered together, you may want to do some combination of these different methods of finding out about how sexual assault report writing may have changed since you instituted your protocols. And in this example, because there are about 30 officers who are involved in writing sexual assault reports at one time or another, you can do an online survey of those officers that's distributed to law enforcement leadership, distributed by law enforcement leadership. As Roberta mentioned earlier, if there are only 3 or 4 potential responders to your survey or to your questions, a survey isn't going to be the best instrument for you to use. You might want to look at a phone or an in-person interview that would be more suited to that size of a response pool. You also you can conduct interviews with 2 key people in law enforcement or 2 people in the prosecutor's office about changes that they've seen. And then taking this information from the survey or from interviews, pulling it together from all of the information that you've collected, and schedule a data review meeting with 2 to 3 team members. If you've conducted the survey by SurveyMonkey, your data will be compiled in numbers and percentages pre-compiled by the tool itself. For the interview data, have each reviewer go over the notes and highlight themes and jot down questions, jot down observations, and pull together the summary notes of those findings. And if the SurveyMonkey questionnaire is brief and mostly multiple choice responses, it may be something that you want to share in its entirety when you report back to the team. But if there are many narrative responses, you might consider compiling those into themes and share a summary back to your team. And remember to consider the information as a whole. If 95% of your responders said that they are very familiar with the new report writing procedure, and a single person commented that no one knows about this new procedure, be careful not to give full weight to the single comment and ignore that 95% response. So bringing it back to the team. If law enforcement leadership was not directly involved in the data review process, the team leader is going to want to share findings with that leadership and talk about the information that you'll want to share with the team. If possible, asking law enforcement officers' leadership to participate in that team meeting or in the presentation, and report back to the team with the summary findings. The findings could include numbers and percentages of responses. Of the 45 officers who were surveyed, 35 responded. Key themes that came up from the surveys and the interviews. There's a moderate familiarity with the new procedure. Officers are struggling with certain aspects of the new procedure. Those things can be documented in themes from what you've pulled out from the information. Pertinent quotes such as, "I feel more confident when writing the report on a sexual assault case." Those are some of the things that could be shared with the qualitative information that you collect, the comments, and then general findings. The review team may want to have a preliminary discussion about recommendations before reporting back to the team. And part of the conversation can include, what does the data seem to indicate? What picture does it paint? Are there places where we need more clarification? And what are the next steps? What should we report to whom? That leads us into, what did you learn and how will you use it? In this discussion of next steps, one of the things you'll want to decide is to whom to report back. Part of that, using your data, is sharing that information. Who will you report to law enforcement officers with summary findings about what you found out? With words of encouragement, what kinds of things you found need some attention, what you've learned. And who else? What other agencies have some stake in your progress? And should they receive a one-page update or a progress report? In what format should that come? And then do it again. Or build that into a schedule where that's happening on some kind of periodic basis, what you're learning and then looking back. How would the team act on recommendations that were made? If it was found that law enforcement officers aren't making good use of this new protocol, does the evidence show that they don't know about it, or that no one is holding them accountable for using it? They can use it, they cannot use it. And what your evidence points to will determine how you decide the fix that fits, what you need to do. Another part of using the data is determining when you will check again for progress. Should you distribute the survey again in 6 months, every year for the next 3 years? Are there changes you would make to the survey instrument itself? If you decide that that's the case, just keep in mind that if you change your questions significantly, you'll not be able to do a comparison with your current responses. Here's an example of short, medium, and long-range set of goals. And it's beneficial for you to lay out your team's goals as a progression, because when you go to assess what's working or not, you won't look at whether more cases are being charged before you know if responders know new roles and procedures. So short term, that law enforcement knows the procedure, the new report writing procedure. It's that reports are being written using the new procedure, and that more sexual assault cases are being charged could be a possible long-range goal. Your team will decide what the short, medium, and long-range goals are that you're targeting. So what it would look like, building a plan and choosing the information and the methods for gathering information that fit your team's size and circumstance. Build a plan that fits your team's capacity, that fits your team's circumstances. If you're in a small jurisdiction with very few sexual assaults that are reported, consider conducting a few key interviews periodically that can provide valuable information about what will help responders feel more prepared to respond effectively. What follows is a quick example of a process that could be a workshop in itself. So it's designed just to introduce you to a particular example and some of the questions that you'd want to address if your team does this type of a review, looking at the protocols. So here's a scenario, a community of 40,000, 2 law enforcement agencies with 2 law enforcement officers and investigators have introduced the new procedures for report writing, and law enforcement is well represented on your team, and law enforcement leadership are supportive of the team's work. This team is interested in and is in a position to do a review of police reports. You'll want to identify a review team, and it's important that advocacy is represented on your review team, as well as multiple perspectives or disciplines represented in addition. You'll want to coordinate with law enforcement leadership on such a review, because you'll want to be able to implement possible changes on the other end of the process. This is an awesome responsibility, so you'll want to ensure that the review team is clear about confidentiality measures in place, and be clear about what within your new protocols you'll want the review team to look at and develop questions that relate to those things that you'd want the team to look for. And it can be just a few things. Since records will most likely need to stay on site, you'll want to schedule a 3 or 4 hour session when review team members can go over reports at the same time in a single session. And maybe, as it says on the slide, looking at 5 previous files and 5 current files. There will be some limits as to what you can find in those 5 previous and 5 current, but it will tell you something. This review session should include time for looking at all findings together and the opportunity for the team to identify themes. In this situation, law enforcement leadership, as I mentioned previously, was on board with the review, and as it would have to be, and is interested to learn what the team discovered. Share findings with leadership, and if possible, invite them to present when findings and recommendations are discussed by the team. And then consider, is this a type of review or something that could happen on an annual basis? And what recommendations do you want to institute and check for progress in the coming year? As I said, this is a very brief overview. There are many details not described here, but it gives you a sense of what some of the questions are for report review, and hopefully gives you some ideas of things that you might consider. So going back to the cycle on assessing team impact and progress. First, have in mind what you're trying to assess and look at what does success look like. Examples: to what extent are healthcare providers using the new 120-hour time frame in your protocols? How frequently are advocates being contacted when a sexual assault victim reports to the hospital? How often are victims being charged for medical forensic exams in your jurisdiction? Is that something that's happening? So what does success look like? Consider what it would look like if you were asking those questions. And take any of those questions. Who or what is a source of information you would look to find that out? What are the ways that you would collect that information? Organize the responses that you've gathered or the documents that you reviewed. Bring that back to the team. And what did you learn and how are you going to use it? And build that into your process for doing it again. So resources and tools. There are several tools that we're going to send in a follow-up email. We sent so far the PowerPoint, and also we sent a list of resources and methods for collecting information. In the follow-up email, we're planning to send information on developing surveys. There's a tool for a few pages of designing and conducting group interviews, including a sample interview outline. And then we have a few sample surveys that we'll be sending as well. And I know that there was a request about that. Before we move to the questions we have here at this point, we've got an announcement regarding the National Institute.
Hi everyone, this is Leah Lutz, also with SVJI, and here we are busy coordinating and planning for our next National Institute, our second one, with the same theme of connect, sustain, and lead. Many of you who are on this webinar came last year, so we hope to see many familiar faces. It will be taking place in St. Paul, October 29th through the 31st. Currently, registration is open for OVW arrest grantees and will open up to everybody July 9th. We expect that there will be plenty of space for all of you who are not arrest grantees, so I've had quite a few questions on that and want to ease your mind. The format will be similar to last year, where we really want to build networks and get you all talking. The content will be different. We're going to be having 2 half-day customized sessions by Dialogue Education, really about reaching you as team leaders and how to facilitate a meaningful process, whether that's designing meetings, designing the flow of your teamwork, and so on, and what you need to know about adults and how we work and how we operate in order to design that process. Really, the essence will be how you work with groups. And then we also will be having 4 content work sessions. One of them will be on protocol development. We will be having an evaluation work session as well. We've had the good fortune of also working with the site here in Minnesota to pilot a project on evaluation, how teams can enhance that and go about that. So we are in the process of taking that learning and the work here that Sharon's doing as well, and we'll be developing an evaluation. As Roberta said, what was your how successful are you, or
to what extent?
To what extent? Thank you. So that is, and we will be helping you answer that question. To what extent are you successful? And then the other work sessions will also be more content driven for your team. So there's a link on our website that you can go find the brochure, information, frequently asked questions, and Sharon will also be sending out the brochure in the follow-up email so you have more information.
Great. We're going to take a look at some of the questions that were sent in and encourage you to also continue to send in questions if you have them. This is Roberta again. We received a question over chat from Nicole Bishop who said, I'm in a jurisdiction of 1.3 million with 12 hospitals and 33 law enforcement agencies. It is almost impossible to get baseline data. What do you suggest? That's a great question, and I know starting can be, almost the hardest thing to do. I guess I would suggest, Nicole, to start small. That is a very large jurisdiction. I can imagine what the diversity of stakeholders looks like there, and just the diversity and the hospitals and the types of law enforcement agencies. So my suggestion would really be to start with 1 or 2 hospitals and 1 or 2 or 3 law enforcement agencies, or that serve on teams that involve a hospital. So 2 of those teams that involve this hospital or that hospital. But really thinking about who are your maybe closest allies right now, who do you have good relationships with, and who could you get on board to work with you in some of your data collection efforts. And then if you can get something started with a smaller number of teams or a smaller number of hospitals and law enforcement agencies and come up after a year or 2 years with some data, you can really use that as your starting point. And you may be able to use that data to leverage interest in the future of other hospitals and law enforcement agencies. Certainly to undertake an entire evaluation plan in that size would take, an almost full-time evaluation consultant. I mean, that would be a big project, but to start small and to get people, to get some of that data collection and then be able to do some results-driven improvements could really shore up interest, I think, of others who then might be able to use their own sort of evaluation person in their own area to continue with what they're doing. I'm not saying doing it in that kind of jurisdiction is impossible. It certainly is not. It can be done, but it certainly is something that on that grand a scale would require some input and help because of the hours that it would require. So I think my simple answer is starting small with the people that you know the best right now. I don't know if Sharon has anything to add.
No, I think that covered it well. The next question that we have is, would you share the checklist survey that you use, or is it linked to the resources? And there are a few surveys that we'll be sending in a follow-up email. But if you have a description of a particular kind of the information that you're particularly trying to find out, you can feel free to send that in an email. And if there are samples that we're aware of, I'd certainly be happy to send those to you. So take a look at the ones that are coming. And from that, if you have further questions, we might have additional surveys, samples that would be helpful to you.
I'm going to do a follow-up. A question came in while I was answering Nicole's question that said, conversely, what do we do in rural areas where law enforcement hardly ever respond? And how would you do evaluation there? Again, I would ask you to go back and think about what do I want an answer to? Can we still focus on evaluation on some questions that are focused on how the survivors that we're serving feel about the advocacy that they're getting, for example, maybe working with just with the local rape crisis center? Or do we want to focus on, can we look at how the hospitals are treating victims and how victims feel about that. But if we want to focus on law enforcement, though, I would suggest looking at cases where they do respond. What makes those cases look different? Is there a case that went really well? Could you do some sort of qualitative case review of a case or two cases in the last year or so that went well and what worked well about them? And, the purpose of evaluation is really to gauge our impact and for process improvement, but we can also use the results of our evaluation or even the process of evaluation to build political ties. And certainly in an area where law enforcement is not responding, it's definitely possible, if you can look at cases that worked well, to use that as a bridge with law enforcement and say, hey, we looked at these two cases in the last year and we found out that, when X happens, that it makes Y turn out, just the way we wanted it or just the way victims wanted it. And we want to commend you guys on that and see what we can do to help build a process that makes that happen more often. So certainly, in a lot of cases, people will use results or even process of evaluation to make connections and to build some sort of political capital with others who maybe should be stakeholders but aren't as strong stakeholders as you're hoping for. So again, in those cases where you have short law enforcement response or a weaker law enforcement response, I would say to either focus on the areas where you're connecting with victims to see how those processes are working, or focusing on, at least the beginning, the cases that work well so that you can build those bridges.
There was also a request for sample protocols to be sent out, and that's something that we'll be in touch with by email. There are some protocols that we can send, so we're happy to do that.
And then Tilton Davis asked, are we looking for correlations or causations among answers to our questions? And had also a question about sample size. And I think that question about correlation and causation is a big one, of course, in evaluation and research in general. And I have to say that I think that at this stage in the evaluation of protocols and services for survivors of sexual violence, we're really looking more at correlations at this point. Without getting too technical, there are a lot of things that can affect the outcomes of cases that are outside of our protocol and what we do in our work with survivors. And so there are a lot of these confounding variables or these things that happen that we don't control that can affect outcomes. So at this point, we're really, though, looking for frequencies and correlations. So perhaps if if the rate of prosecution increases over 5 years, we can't take total credit for it because our protocol was working well, right? Because there might be some other things that are happening. But we can certainly look at the logic of what we're doing and of those short, medium, and long-term goals and say, is it likely that these things are happening in the end? Is it likely that there's a relationship between that and the work that we're putting in at the beginning? And so it is more of a correlation, but it's still very important work. We kind of have to do this building work around correlation before we can get to the more sophisticated research and analysis that can help us understand causation. And I also want to say in response to that we know from decades of work what best practices look like. And so we are basing the work on those best practices that have been established by SART teams and advocates over the last many decades. And so we can feel pretty confident about the direction our arrows are pointing in, if you know what I mean, the direction that things will be going in if we do this, then that. we can be pretty confident about that direction, even if we can't be really confident about the degree or the strength of that connection. And the second question from Tilton was, what's an acceptable, generally speaking, sample size response pool? And, you know, it really depends on the size of your population. You want a certain percentage of that, but most people who do statistics will tell you that about 40 responses. But again, if your population is 10,000 and you get 40 responses, that's not a great response rate, but it's a high enough number to be able to do some statistical analysis on, for whatever that's worth.
And then there was a question about whether or not this is a recommendation about doing an ongoing audit process as a future goal, and it's really broadly recommending that of connecting the practices that you're instituting to be checking out what impact you're having. So that could certainly include an audit process of different parts of your protocol development or your systems response. But it's really more broadly to say building your practices in, having them connected to certain short, medium, and long-term goals, and then checking it out whether or not the results that you were intending are the results that you're getting, and what do you need to change. So I hope that answers that question.
We have another question that I don't know if I completely understand the question, and so I might ask for some more input from Brittany Edmondson, talking about meeting with the designated hospital to address current protocols for amendment in compliance with VAWA. You've been pushing for the local hospital to make changes to offer a victim-centered response to people presenting and to offer or include an advocate during the process. And Brittany notes that they have experienced a great deal of opposition noted by victims and advocates when they were allowed to accompany victims. So I think you're saying that there was a great deal of opposition by the hospital that was noted by victims and advocates when they were allowed to be there. And the hospital was clear until the law changed, the protocols would not change. Oh, I see. So the hospital's saying it's not a law, so you can't make us do it, I think is the question. So how do you approach the meeting? That's a great question. I don't know that that's an evaluation question, but certainly it's a question about making, you know, you're going to be in a very sort of politically charged environment. And I don't know if I'm happy to answer it, but I'm not sure that I should in the role that I'm playing.
Brittany, that's a question that we're certainly happy to help with, and we've got some resources that we are prepared to refer you to, and I can share those with you in relationship to the model policies that we've developed. And so I will be in touch with you as well by email about that information and get that resource to you.
Yeah, that sounds great. I giggled, maybe you heard, because Brittany has sent in bold type, please share. So thanks, Brittany. This is Laura. I'm popping in. I've been behind the scenes. Hi, everybody. You can go to our website. There's a model policies for forensic compliance that we've done in relationship to Minnesota, but it's actually been useful to people outside of Minnesota because we're not that different in some ways. We'll send that link out. And then I'd also just mention the National Technical Assistance Provider on Forensic Compliance Issues is Ending Violence Against Women International, and they have a page on their website. I think between the two of us, as Roberta and Sharon have both said, this may not, at least initially, be an evaluation kind of question. I mean, as people shift their responses, or if there's an issue that they say, you know, it won't work, or it will, or we're worried about this or that, you can set up a line of inquiry to test out certain assumptions that may be blocking people, and that would be kind of the intersection with this conversation. But we're willing to, more than happy to have any of our staff sort of work with you on that offline. And for the rest of you, if you're running into a similar problem as Brittany, I just wanted to make sure you knew about those resources. So I'll put those out in the chat, but thanks.
And this is Roberta again. I think another intersection here with evaluation is, or at least with research evaluation, is that, you know, we do have research that shows that survivors who go to the hospital, that if they're working with an advocate as well as with a nurse, that they tend to be more satisfied, and that they tend to hang with the prosecution longer, and are more interested. So having that, you know, there is research that shows that advocacy is beneficial for the entire process, the entire criminal justice response process, and that it's not something that gets in the way of it. It's something that actually helps to expedite it and make it more successful.
Yeah, Leah is also just sharing me, she caught me, and she's sending out a message now that our next webinar will be more on this topic. So you'll see her note come up in a minute, and that was a great segue, Brittany, thanks. That was perfect. Oh.
Yeah, this is Roberta. The question is a copy of the research. I will send to MnCASA some references to that research, yes. That can be sent out.
Right. Other questions at this time? All right, so we don't see any other questions at this point. We're going to be following up shortly. As soon as you close out of the webinar here, we're going to ask for your feedback from the webinar. So please respond to that very brief survey, and we'll be back in touch with you with the resources that we mentioned. We'll be sending in a follow-up email. If there are no other questions, thanks very much. And we'll be in touch. Thank you, Roberta.
You're welcome. Thanks, everyone. Bye-bye.
Thank you. Please stand by.